Hello, and welcome to another episode of Facebook Live. I'm your host, Dr. Sam Sunshine, and today I'll be discussing common symptoms of upper respiratory infections, the common causes of upper respiratory symptoms, and in particular, the causes of symptoms in athletes, and why they're more susceptible to developing upper respiratory infections. And then lastly, what are some ways we can prevent these viral infections from occurring? So upper respiratory infections are a major source of morbidity and mortality throughout the world. In the United States alone, 1 billion colds per year have been reported with a frequency of 2 to 6 colds per person. Finding effective ways to reduce the frequency of these infections is therefore a very important issue. Over-the-counter medications such as pain relievers, antihistamines, and decongestants have been found to be effective, or have been found to be ineffective because of their limited efficacy against specific symptoms, whereas safety concerns with some antiviral drugs limit their use. So natural health products with properties that stimulate the immune system have been used to combat the common cold. But the results are oftentimes inconsistent and the studies are lacking. But upper respiratory tract infections, again, are among the most common causes of missed school, missed work. Common symptoms include runny nose, nasal congestion, sore throat, cough and headache, prolonged fatigue, etc. Most people know what these feel like. And the principal causes are these upper respiratory infections are the rhinoviruses, the coronaviruses, noroviruses, and influenza viruses, just to name a few. In a 2016 report, it recently was said that the risk of viral infections have dramatically increased owing to changes in human ecology, such as global warming and an increased geographical movement of people and goods. However, the effective efficacy of vaccines and remedies for infectious disease is limited by the high mutation rates of these viruses, especially RNA viruses. And the corona SARS-CoV-2 is an RNA virus. With the progress of research on the relationship between the microbiota of our throat, our stomach, and diseases, these commensal intestinal bacteria have been investigated for their ability to modulate and influence our immune system, not only in healthy individuals, but in sick individuals. Probiotics act to have the potency to decrease the severity of infections in the gastrointestinal and upper respiratory tract. Very interesting. There's been a lot of studies when you look at PubMed for prevention of upper respiratory infections, probiotics come up, and they're these microorganisms that benefit us. So there's this commensurate relationship, and they can be consumed as fermented foods such as yogurt, kimchi, kombucha, pickles, or as supplements. Probiotics in preventing upper respiratory tract infections were found to be more effective than placebo. They've been shown to reduce the number of episodes of upper respiratory infections by 47%, and the duration of the length of a cold by nearly 2 days. Probiotics also slightly reduce antibiotic use and cold-related school day absences. Probiotics are more likely to be effective than placebo in reducing the number of episodes of acute upper respiratory infections, the average duration of these episodes, antibiotic use, and again, school absenteeism. Lactobacillus plantarum in particular demonstrated significant decrease in the incidence of upper respiratory tract infections. Lactococcus lactis significantly reduced the risk of morbidity from the common cold, again, days off from school and work, and decreased the cumulative days of symptoms, including cough, fever, and sore throat. Since viruses evolve constantly and produce a serologically diverse viral population, it's challenging to establish effective means of protecting us from these viral infections. One thing that comes up is, what about vitamin C? We know that a lot of people are using IV vitamin C as a prevention we find it might be helpful. There's just a lack of good randomized controlled trials in the prevention of upper respiratory tract infections. There was a large meta-analysis conducted by Vorahan et al., and they found no preventive effects with vitamin C intake, but it did reduce the duration of a cold. And considering the frequency of upper respiratory tract infections and the fact that antibiotics are unsafe and the safe nature of vitamin C, it can be a beneficial supplement in children even under 6 years of age, especially in those who have a frequent upper respiratory tract infection history. North American ginseng extracts have also been shown to enhance immune responses, such as improving the production of lymphocytes and macrophages. Recently, an extract of North American ginseng was shown to be capable of enhancing lymphocyte function and initiating acquired immune responses, so it seems to boost our immune system. One study showed that a moderate dose of North American ginseng was associated with an absolute risk reduction of recurrent colds. The ginseng extract was also found to be effective in reducing the severity of symptoms and the number of days symptom-related to all colds was reported. And it is generally acknowledged that the main prophylactic measures against these infectious diseases are mainly vaccines and everyday hygienic behaviors, such as gargling and hand washing. So I'm going to talk a little bit about the benefits of hand washing and gargling and nasal rinses. There was a study out of Japan that gargling with iodine solution was effective to reduce the incidence and episodes of acute respiratory infections. Oftentimes these viruses colonize and they seem to be destroyed. They colonize in our throats and our noses, and that gargling and rinsing with a hypertonic solution and proper hand washing, using soap and disposable paper towels effectively limit the transmission of different viruses. So again, hypertonic saline gargles and nasal wash may be useful in preventing and for the care of patients, even with COVID-19. There are some current evidence that emphasizes the need of more randomized controlled trials to evaluate the role and the mechanism of these nasopharyngeal washes in COVID-19 patients. But largely studied in Japan, there's multiple studies that have come out of Japan about the benefits of hand washing, flushing the nose and mouth with a hypertonic saline solution. It may bring down the viral load, reduce transmission, reduce symptoms, and the duration of the illness. And it's interesting because Japan was the second country after China to contract COVID-19, and so far there's been a very low infectivity rate and 1 case per million in the population. So it's quite low compared to the majority of the other countries that have been affected. Social distancing, face mask use, and hand washing are the most important measures to halt the progression of the virus. In Japan, they also practice warm saline oral gargles, and it's also included in flu management guidelines of the country. One of the things we use is just a nasal irrigation. NeilMed makes it. You can pick it up at CVS. Also the neti pot. I was going to bring examples of those, but they're very easy to use, usually a lukewarm water with a saline solution. And you mix it together and lean over a sink. The bottle you squeeze and it goes in one nostril and out the other and kind of rinses your nose. The neti pot is less forceful. Again, you want to go in the nostril, you can breathe through better, and then hopefully it can come out the other end. You don't want to use it if you can't breathe through either nostril, because then it will just be uncomfortable. There was another study out of Japan where we looked at 20,000 children for 20 days, and one group gargled with tap water or green tea or a saline water, and the other group who did not gargle. And what they found was there was a lower there was reduced incidence of fever, in the group of children who were gargling with green tea, and there was a reduced incidence of fever in children practicing gargles versus those who were not. So a lot of good information about just doing those simple things. So maybe a practice you might consider taking up on a daily basis. It's probably just something that you need to do before you go to work, maybe in the morning or in the evening. You probably just have to do it once a day. So again, so far we've talked a little bit about probiotics and their benefit, nasal irrigations, throat gargles, and I'm just going to reference my notes. There's a lot of information, and I think I need to have a professional writer put my talks together, and that'll make it a little bit easier. But there's so much information out there, and it's so interesting. And again, my big pet peeve is that a lot of times when we start to develop symptoms of a common cold, like nasal congestion, sore throat, fever, the first thing we think about is reaching out to get an antibiotic. And there are about 200 million unnecessary prescriptions written every year in the United States for sinusitis, when most of it is viral, and about 200 million unnecessary prescriptions written for bronchitis, which again is entirely viral, and rarely is it bacterial. So when we're looking at causes of these upper respiratory symptoms, we really got to ask ourselves, what are we treating? And about 20 to 40% of the time it could be viral. Another 20 to 40% of the time it could be just an asthma exacerbation. It could be allergies. And sometimes it's hard to determine. Allergies generally don't give you fever and you have more clear secretions. Whereas if you have an infection, it's more likely to be discolored. Usually it goes from white to green to brown. And oftentimes patients will bring in their sputum in a napkin. The sputum color doesn't tell us anything. So you really got to look at statistics. I mean, the chances of it being bacterial is about 2 to 5%. And again, most people think that antibiotics are the panacea for everything from a sore throat to an earache to a cough. And what it does, it really damages your microbiome more than anything. And that's such a critical ecosystem that we need to maintain. And when you talk to some people and do more, again, functional integrative medicine, they'll say that a course of antibiotics will set your microbiome back 5 years. We do know there are side effects. Zithromax, 1 in 20,000 people apparently who take a Z-Pack will have a heart attack. These are not benign medications, and that they are relied on as the coup de grace to treat upper respiratory symptoms. And it's always been a pet peeve of mine. Even when I was working with, I had a group of doctors previously to going into solo practice, I got frustrated because they were treating people with antibiotics even though they had symptoms for, 1 day. And when I would confront them with this, they'd say, it's a lot easier to prescribe an antibiotic than to take 10 or 15 minutes to explain to them why they don't need an antibiotic. And there are studies showing that doctors feel obligated to give the patient something when they come into the office and not to leave empty-handed. And that a simple antibiotic prescription, which they think is super safe, like eating jelly beans, which it's not, is an easy solution to make that patient leave the office with a big smile on their face. So anyway, there are some antiviral therapies that are coming out. One is Xofluza, developed for influenza. And if you take it within 48 hours of developing the flu, so if you have flu symptoms and you're swabbed and it's shown that it helps, it may reduce your symptoms and the duration. Tamiflu and I think Tamiflu is the main oral one that we've been using for quite some time. It's losing some of its efficacy just because of the influenza mutations. So this Xofluza, it starts with an Xofluza, Xofluza may be promising as an over-the-counter anti-influenza treatment in adults. I think it's for people over the age of 65, and the cost on GoodRx is $165. So again, can't understate how important it is that we understand there's such a significant impact on our society from these acute respiratory tract infections. The average adult gets anywhere from, depending on what study you read, 2 to 4, 3 to 6, and these can be the major cause of fatality in children under the age of 5 are these upper respiratory viral infections. Again, the typical things we have, these decongestants, antihistamines, expectorants, and antibiotics don't help. They've been shown over many years to be very ineffective. Again, I will have people try these if they've been having symptoms for maybe 2 weeks and symptoms are still there. Cough is certainly a very difficult symptom to treat because it's a reflex that is built in to prevent debris from coming into our lungs, and so you don't want to suppress that. A lot of patients just wish they could turn the switch off so they just don't have to cough anymore. Very difficult to treat. A lot of times she's just calming the inflammation down, making sure you're staying hydrated. Using throat lozenges can be very effective. But it is difficult to treat. Sometimes I'll recommend some oil of oregano or N-acetylcysteine, which again can maybe help support the immune system in the upper respiratory tract. So again, we've talked about the benefits of probiotics, nasal rinses, gargling, North American ginseng, again, can be pretty helpful. And these have been studied in randomized controlled trials. Okay. So another fact, the common cold is the most frequent and universal infection. And most people will have about 200 colds in their lifetime. And that's pretty significant. And colds cause more illness in children than any other disease combined and are responsible for up to 50% of school absenteeism. So again, pretty dramatic. Again, I think the basic stuff of frequent hand washing, social distancing, again, now we're wearing masks, I think are important. Again, not just to reduce the spread of COVID, but these upper respiratory infections because we're getting into cold and flu season. Another one is bovine colostrum. Bovine colostrum is made from cow's milk right after they deliver their calves. And meta-analysis has shown that bovine colostrum, which you can get in capsules, may be effective in preventing the incidence of upper respiratory infections. So again, preventing and also reducing the days and episodes of upper respiratory infections in adults and exercising adults. So that's another interesting fact that in my research came across. Again, it's one of the things I've recommended for years for preventing upper respiratory infections. It's always weird to talk to patients about bovine colostrum. It does have milk products in it, so if you're allergic to milk, it's something you might want to take with caution. So I thought that was pretty informational. So in terms of a prevention. And it does seem to work by, again, upregulating our immune system. It's rich in bioactive components, including growth factors. It has immunologic mediators. It's antimicrobial. It has, and these antimicrobial peptides are like lactoferrin. And these are very similar to the human colostrum. But it's a lot easier to get bovine colostrum or cow colostrum than it is human colostrum. In another meta-analysis showed that oral supplementation, again, these are mostly going to be in capsules or a powder that you mix with water, reduce the incidence of upper respiratory symptom days and episodes in adults involved in exercise training. So another thing, so again, we've talked about bovine colostrum, North American ginseng, gargling, probiotics. What about flavonoids? And these are foods that give, flavonoids give fruits and vegetables or rich colors. And how do they work? They also seem to help upregulate immune function in healthy adults, and they seem to also reduce the incidence and duration of respiratory symptoms, including sinusitis, tonsillitis, pharyngitis, otitis media, and the common cold. So again, flavonoids. And there are 6 different types of flavonoids. I won't go into those, but it's isothiocyans, flavonoids, flavones. You can look it up. Again, the first line for treatment of the common cold, if you do get symptoms, really rest, hydration, and preventing spread. And I think that's one of those things that if you are sick, stay home. Antibiotics, wow, again, ineffective at treating the common cold and any of these viral infections, including COVID. I can't tell you how many people have requested a Z-Pak when they think they have COVID. Has not been shown to be of any benefit. If you have information that's contrary to what I'm saying, please send it to me. I'm always excited to learn more. What about in athletes? Again, that's a big concern because I do take care of a lot of athletes. I'm an athlete myself. I think exercise is super important. Should be done on a daily basis. Mixing up the exercise so it doesn't get boring, and also so you don't overuse certain body parts is important. When we look at athletes, again, it can be a little confusing when athletes have symptoms that seemingly are upper respiratory symptoms. They might have a sore throat, they might have a runny nose. We can't exclude the possibility of allergies. Could it be an asthma exacerbation? Could it be a reactivation of Epstein-Barr, which again is not uncommon? Far more common is Epstein-Barr reactivation than, let's say, a fungal infection or a bacterial infection. These flavonoids can be very effective, again, found in colorful fruits and vegetables. They have been proposed to reduce the incidence of upper respiratory tract infections due to their range of physiologic effect, including, again, antiviral, anti-inflammatory, cytotoxic, antimicrobial, and they're antioxidants. So they can reduce inflammation primarily by decreasing this NF-kappa beta. And I won't get too much into the details of NF-kappa beta. That's such a big term when it comes to inflammation in the body. So that's kind of interesting. So flavonoids, and again, you can get flavonoids in supplement form. If you're interested, let me know. Sometimes a lot easier to take on a daily basis than to make sure you're eating, the blueberries and cabbage and purple potatoes and things like that. That's really what we try to want to do, is eat the rainbow of colors. That's where your bell peppers and so forth. Okay, so the next thing is quercetin. So quercetin in particular is a flavone, and it's been shown, so this is a supplement that you can get in capsule form primarily, and it's been shown to reduce viral internalization and replication. So that's kind of interesting. So it can be used as a preventive measure in taking. It seems to decrease the viral load and lung inflammation and airway hyperresponsiveness. So quercetin is another, again, a 2014 study in humans. So it's rare to get people do supplement studies in humans. A lot of studies have been done with quercetin in mice and showing, and these are mice susceptible to upper respiratory infections, have been shown to be very effective in reducing upper respiratory infections. And again, there have been this one study on quercetin was very, showed promise as a way of preventing upper respiratory infections. And again, despite our growth in medical knowledge and understanding, modern treatments for the common cold have advanced little. No cure for the common cold exists, yet the disease imposes costs of around $40 billion per year in the United States alone, and is a leading cause for doctor visits and missed school days. Again, I kind of stated that before, but it's really important to realize that. And again, they're the leading cause of death in children under the age of 5. Again, we can't get rid of them. They've been around since the time of antiquity. The Egyptians talk about them. They're here. It's about how do we manage them? How do we prevent them? How do we prevent the spread of them? And then what can we do when we do come down with symptoms? Today, I'm not going to focus too much on prevention. I'll do that in a subsequent talk. And I think that's all the notes I have. Hi, Martha. Thank you for listening. If anybody else is on this Facebook Live, please type in your name and tell me where you're from. And if you have any questions, please let me know. And if there's any topics that you would be interested in learning more about, please let us know. You can call the office at 949-460-9111 and talk to Sandy, the office manager, and say, hey, have Dr. Sunshine talk about X, Y, or Z. Because I'd love to come up with I have so many things I want to talk about, and I'm just trying to do things that are relevant. So right now, obviously, we're coming into cold season, flu season, and we're in the midst of a pandemic. So I think it's important. We need to take care of ourselves, eat healthy, stay away from fried food, stay away from highly refined, highly processed, sugary foods, and make sure you get adequate sleep. And make sure you're exercising. Exercising has been shown to reduce your incidence of colds. However, if you're an extreme athlete and you're doing high intensity exercise or overtraining, you're going to increase your risk of developing upper respiratory tract infections, more so than somebody who's not doing vigorous exercise multiple days a week, because it does seem to suppress our immune system. So again, taking vitamin C has been shown. This is a clinical study that's been repeated in marathon, people training for marathons, that you reduce your incidence of colds by taking vitamin C during your training, and then certainly after a race is supplementing with vitamin C, and that does seem to help reduce your incidence of developing a cold. So if you are exercising, making sure you're getting a lot of healthy fruits and vegetables in your diet, getting enough rest, staying hydrated. I think those are the things that can help prevent that. Hi, Michelle. So come on, ask me some questions. If you don't have any, I think next week, again, I still want to kind of talk about hormone replacement therapy in men and women. I think these are very hot topics. Every week in my office, I find that men and women have extreme concern and many questions about this, and I think it's largely misunderstood in the medical community, and I think also in the and just in the general community with patients. There's a lot of fear around hormone replacement therapy, and I think it's unjust. There are certainly subtypes of people that we don't want to use hormones in, but the majority of people where there isn't a contraindication, these can be very life-changing and very supportive, and things that can be used throughout our adult life. Okay, without further ado, again, thank you for tuning in to our Thursday noontime Facebook Live. This is Dr. Sam Sunshine, OC Sports and Wellness. Our phone number 949-460-9111. Or if you want to email us, it's info@ocsportsandwellness.com. Thank you.